Hello, good morning. I am Donna Mitchell with Aging Advantage, and we are here today with another ARPA Talk. We want to welcome everyone today on this beautiful Monday morning. I do want to let you know today we are going to have a great speaker joining us. And just wanted to let you guys know a little about what we do through Asian Advantage as we are providing these educational opportunities for those that are struggling with the post pandemic struggles like isolation and food and housing insecurities. We help make connection through our local resources and our community. So today we're going to have Bryce Graham, and he's going to talk to us a little bit about the Medicaid or Medicare, I'm sorry, 101. And you may go ahead, Bryce, take it away.
Hello, thanks, Miss Donna. So my name is Bryce Graham. So I work for an independent Medicare brokerage called High Quality Insurance Agency out of St. Louis. I'm here today with Miss Tamara Kaufman. She's over at Archwell Health. She can kind of give you a little bit about what they provide, but my job is basically to clear the Medicare confusion that's within the industry. So take away all those phone calls you're getting and go to somebody that can answer the questions right away for you. So what we're going to go through today is if you guys can grab a pen and paper for me. I'm just going to go through the basics of Medicare from this year to next year because there will be lots of changes, and then give you some important dates to kind of write down too. So what I want you to write down, I can't really see who's out there, but Miss Donna will let me know who messages, and we can kind of connect afterwards if you have questions. But my services are no cost, so all you got to do is give me a call, and I'll be more than happy to help you out. So again, I don't work for any insurance carrier, but I'm contracted with most of the big ones. So a couple of the ones you probably are familiar with are like United Healthcare, Aetna, Anthem, Devoted Healthcare. There's about 16, 17 other ones out there, but I don't work for any of them. My job is to do what's right for the individual. So your Medicare is yet red, white, and blue card. So your Part A of Medicare is going to be your hospital, and then your Part B is going to be your medical. So your Part A is what you've worked your whole life for. You worked your 40 quarters. You've been paying into the system your whole life. The 40 quarters equals 10 years. And then your Part B is what you have to pay for. So if you're taking notes right now, what I want you to write down is your Part B of Medicare. Your Part B premium for this year is $185. For 2025, next year that'll go up to 206.50. So that's a pretty big jump from this year to next year. But that 206.50 will start January 1st for anybody that has a red, white, and blue card. Okay. So your two options with Medicare are going to be that Part A, that Part B, and then those are going to cover about 80% of your coverages. So what's left for the member is how do you want to fill that 20% gap to get to 100% coverage? So to get to that 100% coverage, they give you only two options, but Medicare, they like to make it difficult. So they got plans that are A, B, C, D, E, F, G. They go all throughout the alphabet. You've probably seen that all over Facebook, Instagram, stuff like that, commercials. But to simplify it for you guys, I want you to write down on a piece of paper. There's option one, which would be the Medicare supplement insurance. So what this is it's remaining with that original Medicare. You add it to both your Part A and your Part B, and then you add on what's called a Part Medigap policy or a Plan G, or an N or an F. There's quite a few different options with that, but what it is you remain with that original Medicare. You don't get any of those fancy benefits, but it helps pay for some out-of-pocket costs that come with original Medicare, and it fills that 20% gap to get you to that 100% coverage. And then all you're responsible for paying is that monthly premium on that, which again, that'll depend on your age and a couple other different factors. If you're a smoker, your rates could be a little more expensive. Those do go up yearly, but your Part B deductible for 2025 is 257. And 26, starting January 1st, that goes up to 288. So once you meet that 288 deductible on out of pocket expenses for 2026, everything's covered at 100%. No issues, no bills. You're never going to receive a bill in the mail. So one of the biggest kind of examples I like to give is say you get hit by a bus. And I know nobody wants that to happen, but that's very possible nowadays with the way people are driving and stuff like that. But if something significant happens, instead of having $100,000 bill in the mail, you're going to pay that deductible of 288, and then you're never going to see a bill come in after that. So that's the more peace of mind route. Now, one thing in addition to that that you have to add on is your Medicare Part D plan. So you always have to have credible drug coverage, whether through a Part D plan of Medicare or if you go to the VA, if you have TRICARE for life, there are a couple other exclusions, but outside of that, you have to have a Part D plan. Otherwise, you will get penalized by Medicare. So that is going to be the original Medicare route. So that's option one. And then option two on the right side of your paper, I want you to write down Medicare Advantage plan. So what this is this is a Part C plan, or Medicare Advantage. Again, they like to use the whole alphabet, but it's an MAPD, which stands for Medicare Advantage Prescription Drug Plan, or Part C plan. So what it does is it combines your hospital Part A, your medical Part B into one plan. Most of these plans are going to be $0 a month. These are those plans that include most of those fund benefits that you're utilizing, that you've been paying into the system for your whole life. So a lot of them are going to be $0 monthly premiums, but your responsibility as the member is to follow the rules with it. So instead of you being the quarterback of your health care, you're basically letting one of those big insurance providers become the quarterback, and they basically say, this is a copay for this expense. This is your primary care visit, your doctor visit, stuff like that. You go to the hospital, you'll pay a copay, stuff like that. But they give you the fun benefits to keep you healthy. So they give you the dental, the vision, the hearing, the over-the-counter benefits from the pharmacy, which you can use for Band-Aids, cough drops, toothpaste, toothbrushes, NyQuil, cold remedies. If you go to the gym at all, you get a gym membership either through Silver Sneakers, Renew Active, or Silver and Fit. And then they do give you quite a bit of other amenities as well, because their job is to keep you out of the hospital, make sure you stay safe. Some of them will give you a life alert pendant. But again, you just have to go by those rules. And then they all have what's called a max out of pocket responsibility. So this goes the same way as that supplement plan. So instead of you having $100,000 medical expense, if something significant happens, all you are going to pay is that maximum out of pocket, worst case scenario. But again, only 3% of people are ever going to meet that max out of pocket. That just depends on the scenario, but it's more of a pay as you go. So you're only going to pay for those services if you utilize them, which only 3% of people nowadays are going to reach that max out of pocket. But it kind of just depends. It depends on your health and other factors like that. So what these plans also include is they cover your prescription drug coverage. So you don't have to add on a Part D plan, since it's got that Part D wrapped into it, under that MAPD, okay, which is that Medicare Advantage Prescription Drug Plan. Now, one thing I do want you guys to watch out for next year is there will be quite a few changes within all of these carriers. So it's not just one carrier in particular, but last year they made a big change within Medicare. It's called the Inflation Reduction Act. So that affects a lot of your guys' prescriptions right now. You probably saw a jump up in those prices for this year, and it's all due to that new rule. So for next year, one thing to watch out for is the deductibles on some health plans. Those will range up to $615 depending on your plan. This year it's $590, the deductible. And then last year, one of the big changes was they got rid of the donut hole. So everybody in the past was like, oh, I don't ever want to reach the donut hole. Well, there's no more donut hole. They just reconstructed it. They basically reconstructed it into the deductible. Once you reach that deductible, then you go into the copay stage, which is the initial coverage gap. Then instead of going into the donut hole, then you would directly go into that catastrophic once you reach that $2,000 out-of-pocket cost on expensive prescriptions. And then for 2026, another big change is going to be the out-of-pocket cost on all of your Part D plans. Instead of $2,000 for this year, that goes up to $2,100 next year. So those are the big changes from this year to next year. That's a whole new to Medicare spiel that I'd give to a new member. I like to keep it simple with you guys. A lot of people would get into the nitty gritty of it. It's very kind of basic if you break it down into two different segments. So before I jump off here, I'll give you guys my contact information, and then I'm going to have Miss Tamra over at Archwell Health give a little talk about what she offers because I do work pretty closely with her as well. So my name is Bryce Graham. That is Bryce. Last name is Graham, Graham. My phone number is 314-328-4567. It's pretty easy to remember. And then the name of my insurance agency is High Quality Insurance Agency, or HQ Insurance, if that's easier to write. But my website is going to be www.high-quality, QUAILTYINS.com. So you can search me on Google. You can go to my website. There are brand new news articles that I put out, but I'm more than happy to help you guys out. If you have questions, I'll come to you or we can meet at the office. I do a lot of in-person appointments. My job's to help you guys. So I'm not here to make money. I'm compensated the same from any government agency, any of those big insurance companies, which is why my services are $0. My job's to do what's right for the member. Okay. And then Miss Tamra can give a little bit about what she offers. She's from Archwell Health, which is a primary care provider's office. So I'll introduce her. So this is Miss Tamra Kaufman from Archwell Health.
Hey, thanks, Bryce. Hi, everybody. Appreciate you guys getting on here today and learning and educating yourself. Bryce does a really great job with our members and those that are interested because we are a primary care provider for adults who are 60 and over that have Medicare Advantage. So we work with those members to keep them healthy, active, and out of the hospital. That's the goal with Archwell. We offer a lot of additional benefits with that, such as transportation assistance to your appointments with our office if you need it. Also, we have doctors that actually have time to get to know you and better help you take good care of yourself. Our goal is to keep you healthy, active, and out of the hospital. We've got, 5 open centers in St. Louis currently, and there's a 6th one opening later this year. So pretty much most of the metro area where you might be living, we have a center near you. We would love to have you come in and take a tour and learn more. If you're looking for a primary care, you can always reach me by phone, and my cell phone is 314-914-2193. Feel free to reach out to me if you're looking for quality primary care that really takes the time to get to know you and has your best interest. And if that's something you're looking for, Bryce and I work together all the time to help people make sure that they're getting the best coverage for their health care and the best primary care to help them. Like I said, feel free to reach out with any questions to learn more. Again, my number is 314-914-2193. Thanks, Bryce.
Awesome. Thank you so much. So Miss Donna, I think we are all good to go. Okay. Do we have any questions from anybody?
Well, thank you guys very much for that.
Mhm.
We do actually have a question, and you may have actually touched on it a little bit, but I'll still go ahead and read it off. That way you can, reiterate or maybe even dive into it a little deeper if you did touch on it. And the question is, do you have any examples of specific changes that's coming to Medicare?
Yes.
Like
So
anything in particular they need to watch out for since open enrollment is coming up pretty soon next month?
yeah, so some of the big changes to Medicare are going to be that Part B premium is going to be a pretty big change from this year to next year. So that's going to go from $185 to $206.50. And then within the plans, I can't tell you all the benefits yet. If you call me after October 1st, I can get into the benefits with you guys. But legally, I'm not allowed to talk to it until the first of the month. But some of the big names changes are going to be some of the carrier plan names are changing. So watch out for that. You should receive an annual notice of change in the mail from your insurance carrier. They're legally supposed to get that to you by October 1st. So if you haven't received it yet, that'll have all the big changes for next year. But just watch out for the max out of pockets going up, deductibles being added to the plans. Some of the copays are going to change within the carriers. Plan name changes. That's a big thing for next year with some carriers. So watch out for that. Um, and then that if you're on a supplement plan, it's really going to be that Part B deductible, which is that 180 or 288 for this next year. And then this year it's 257. So that's another jump up right there. So those are some of the big changes from this year to next year. But really, I would watch out for those deductibles since that Inflation Reduction Act took place last year. A lot of the insurers figured out that they were enduring a lot of the costs from the members. So what they're doing now is reconstructing those drug coverages. So that's something that'll be affected pretty significant this next year. But those can range the deductibles from plans depending on your carrier. Can go from $0 on the plan to I think $615 for 26. So just watch out for that.
Wow.
But there will be some significant changes, and then the big dates I want you guys to write down every year. It's going to be that annual enrollment period is October 15th through December 7th. Even if it falls on a Sunday, it's always going to be the 15th of October through December 7th. And then anybody under 65, their enrollment period is going to be November 1st until January 15th of next year. Okay, so I do work with people under 65 as well. So I don't just do Medicare, but if you have questions about insurance in general, dental, vision, hearing, anything like that, I can definitely help you out with that. But those are some of the big changes from this year to next year.
Great. That is so funny because just at the end you answered the other two questions
Oh, okay.
that were out there. They wanted to know the dates and then who qualifies for it. So that was great. I guess you already knew that that was maybe a popular question,
That is
maybe
that's a question I get every
something.
day, and that's the one
Really,
time in the year you can review it. So I always jump on those 6 weeks because your
that
phones
is
are going to
really
go
good.
crazy and the spam calls are going to start popping up pretty soon. So watch out for that.
Oh wow. So now that you say that, is there a way to determine? Because you're right. A lot of people are saying they get spam calls all the time. Is there a way to distinguish
Um,
a regular type of call versus a spam?
yeah, so one thing to watch out for within that, because I do have quite a few clients that get all these same calls you guys are getting, is anybody that calls you and says they're from Medicare, Medicare is never going to take the time to call you. So that's your one big red flag right there. Medicare has too many members to deal with. They don't have enough manpower to call everybody. Even if you're enrolling into Medicare, they're never going to call you. They're only going to communicate everything through the mail with you. And it'll come with the stamp. I want you guys to write this down. So the stamp is going to be, it's going to be CMS. So Charlie, Mary, Sam, which stands for the Centers for Medicare and Medicaid Services. So any important documents is always going to be stamped with that on there. Otherwise, at the very bottom of the mail that you're going to be getting, because you're going to get quite a bit of spam mail as well this annual enrollment period, there will be a disclaimer on every insurance brokerage that sends you mail trying to get you to enroll into a plan. They have to have a disclaimer on their marketing materials, and it'll say, we are not associated with the federal government. We provide so and so type of plans. Please call this agency. They are legally have to have that on there. Otherwise, you can report them as spam. But you're going to get a lot of mail. You're going to get a lot of phone calls, text messages. Um, if you have questions and would like to reduce those, I can give you a couple numbers. Um, there is a no call registry that you can apply for. You just call from the same number you're on. I can give you that number if you'd like. But really, I would just disregard all those phone calls. Social Security is never going to call you unless you request a phone call yourself. But Social Security is a whole nother story. But they're never going to call you as well. But there are a lot of people impersonating Social Security nowadays too. But don't ever give out your Medicare number, your red, white, and blue card number. Don't ever give that out. Don't ever give out your zip code and your date of birth to anybody that you don't trust or you don't want to switch your plan. That is the 3 pieces of information that they need to switch your Medicare plan without your permission. It happens daily. So, and seniors are the main target of that. So that's something to watch out for. So unless your broker's working with you, don't give that number out, but that's how we can look up your plan name and stuff like that. Okay.
Okay. So pretty much is it, and this is just a question I'm just asking from my own personal um, use or knowledge. When you have a broker, is that person kind of the person that's assigned to you throughout the whole process, or is it just like a one-time thing? Um, every year the broker
Yeah,
reaches out
so
to you. How do you know,
yeah, so if you're not
or have
working with a
somebody on?
broker, so a broker versus an agent. So an agent's going to be somebody that's directly contracted with an insurance carrier that can
Okay,
only talk to you about one plan. So broker is independently contract, which is what I am. So I don't work for any of the carriers, but I'm contracted with most of them, which is why I own my own agency. So the biggest benefits to working with the broker is they're going to be kind of your go-to person for any questions you have. If you need answers about how to go about it within the member services portal, or if you need help with kind of getting into any member issues, we can direct you to that department. Otherwise, they're going to call that 1-800 number and they're going to get somebody from out of the States. That's going to be very frustrating to talk to. I mean, I have people that go through it, they run around, but I'll check in with you guys periodically. If you work with me, you'll get a text from me saying, hey, did you get your ID card? If you have any questions, please let me know. I won't know if you have any questions unless you let me know. Okay, so my job's to do what's right for you guys. So it doesn't matter which carrier we go with. If you have one in recommendation, I can tell you my honest opinions about it. But other than that, my job's to do what's right for the member. So I'm here to just guide you guys along that process because they make it too difficult nowadays to do it yourself. If you do it yourself, then you must know a lot about insurance because there's quite a bit that goes into it, which is why we take all these tests and we have to recertify every year. So definitely utilize a broker because their services are no cost at you if you're not working with one already.
okay. And so then also that brings me to another question, and I'm kind of, because of the community that we work so closely with, mainly seniors or those with a disability. The I guess too, if they are a disabled, qualified disabled, but they're under, so they are within that age range that we service 18 through 59, you are also able to help them out, or you do seniors only?
So I work mainly with seniors, but there are specific situations for individuals that will have Medicare under 65. They would qualify by having a qualifying disability through Medicaid, which would be the state help funded program. So Medicaid is going to be that Missouri Health Net card. So anybody that has a Missouri Health Net card, if you've been on Social Security disability income for at least 2 years, you're automatically going to qualify for Medicare. But if you have a Missouri Health Net card right now and Medicare, you're going to be eligible for what's called a dual special needs plan, which will take those federally funded Medicare benefits and the state funded benefits from Medicaid. It'll combine them into one plan. And it's called the dual special needs plan, which will get you a lot of assistance from the government and the state to help pay for monthly expenses for food, dental, vision, hearing. Quite a bit of benefits are built into those. But other than that, really the Medicare is going to be the main situation, but I do work with the marketplace as well, under 65, which would be like the Obamacare plans, which a lot of people know
Okay.
as, but they're referred to as marketplace plans. So I am a broker for those as well. So I can help you if you need help on that. But that is going to open up November 1st for next year.
Okay. So November 1st of 2025, and that
Yep.
it actually take place January of 26
Yes. So you'll
for
enroll
those. Okay.
November 1st, and then anytime after November 1st, you'll enroll for a January 1st effective date. And then if we get in touch after January, it'll go for a February 1st effective date, but it goes until the 15th of January of next year for the open
Okay.
enrollment period for marketplace coverage.
Okay. And then also another question, I'm looking like that because I'm almost forgetting it. It was back to geared towards the seniors. Oh, are you able to suggest plans and kind of help them with the best choice, or do you just come on as someone that just kind of give them the details of each carrier, and then that choice is solely up to them? Can you
No,
have
so
any input in it at all?
So that's my whole job, is to give you the input, the ins and outs of it, compare the
Okay.
coverages. If you have questions about, oh, is this the best carrier for me? Everybody's situation's a little different. So nobody's going to go to the doctor and have the same prescriptions, the same doctors they see, unless you're a twin or something. Very few situations are like that. But if you're unhappy with your current plan, I highly recommend getting in touch with somebody. It doesn't even have to be me if you don't want to work with me. But just get in touch with the broker if you're working with one already. But just talk to them, say, hey, I'd like to review my health plan for next year. That's going to be the biggest benefit to you. We'll give you the ins and outs. If we think if we may recommend that you make a change, then we'll do what's best for you guys. But again, we don't work for the insurance carrier, so we don't have to meet a quota. There's no like, oh, you have to get this certain amount of plans for next year. It's not like that. We're just here to help you guys
Okay.
out and do what's right for the member. So even if you want the worst plan, I'll give you the bad parts about it, but we can still help you with that plan. But it's
Okay.
kind of just up to you guys, and I'll just be your kind of guidance to help you get into the best plan for your situation.
Great. That sounds good. And then also with that, I'm sorry, I'm getting,
Oh, you're
I
good.
didn't have my laptop charger
Mhm.
with me, and it's giving me an indication, and I don't want it to just go blank on us. So you may see me kind of moving around, but let me get this plugged in so that we do not drop at all, because this is some really good information here. And I want to make
Donna, I
sure.
can make you feel better. That's actually what happened to mine. It was plugged in, but for some reason it wasn't connected and it died on me and I had to scramble. I think my
So you
cord is
understand
bad.
exactly how I'm feeling right now, then, right?
Yes, yes.
Usually,
And I can offer some information too while you're looking for your cord to everyone.
okay,
I've been working with Bryce for a couple years, and one of the great things about the people that work with him is the fact that they really do personalized service. He meets with the clients either at their home or at Archwell, or he'll meet them at a coffee shop, whatever they're comfortable with. And he really does dig into, what specialists are they seeing? Who is their doctor? What medications? How do they live their lifestyle? So when he's going through those plans with them, he can really make a targeted recommendation on what's going to be the best option to give them the most benefits and coverage.
right. That is really good, and that's something that is very beneficial and be very useful because I'm sure you had Tamara, you had been at Archwell, and even Bryce yourself were doing this for so long. One of the biggest things for the seniors is that we want to make sure that we build that rapport so that they trust us. Once they trust us, then we don't have a problem, and then that helps us to do our jobs better, right? Because we're more comfortable in knowing that, okay, I can go ahead and make the best recommendation. I can kind of be the pilot in this situation to help them to get to where they need to be and what they need, which will be, because it can sometimes be very, very frustrating,
Mhm.
and it's sometimes it's even sad, because we can only imagine what they're experiencing, and what they're going through. And most definitely, we always want to make sure that they have the best options, the best choices, what's best for them. So,
Yeah.
Bryce, another question as well is, you were saying that it's going from one number to another number, right?
Mhm.
And the way that they pay for this is like out of pocket. What if some people's income, because I deal with some people sometimes that have a monthly income is like $900, not even $1,000 a month. And by the time they pay their bills and things, they don't have a whole lot of money even for groceries. So in situations like that, what do you suggest?
So that's kind of situation based, but for those type of individuals, Medicaid, I would recommend applying for Medicaid, which would be the state help program.
Okay.
because the way I look at it is you're not going to get the help unless you reach out for it for yourself. So if you apply for it and they deny you, they deny you, but you went out of your way to apply for it. And then if you get accepted, Medicaid may pay your Part B premium at 100%. So then you, as the individual, are left with $0. So it depends on those specific situations, but the income level of $900, we'll just put that, you would qualify for Medicaid, which means just going out of your way, applying for it on mydss.mo.gov, which would be the state Medicaid website. You can apply for that. And then once they reach out to you and you get approved, then you get in touch with me and we can get you set up with a plan. That's a dual special needs plan. But there are some specific plans out there that'll help pay your Part B premium back if you're not on Medicaid as well. They're called Part B give back plans. That would be an option as well. But there are a lot of information and help support systems to help pay that premium. But a lot of the times that Part B premium is going to be taken out of your Social Security check. So most of the time you're going to not see it unless you're double checking that nonstop. But a lot of the times people don't really even notice that it's taken out. But everybody on Medicare is paying that Part B premium for it, unless you have
Okay.
Medicaid.
Okay. All righty. Um, then at that point as well, like I guess one takeaway, you want people to know when they're looking at a Medicare or supplement plans. Do you have one takeaway that you can provide us with or share
Yeah.
with the
So
people?
one thing I would look at is everybody's situation is different. So sometimes the supplement plans are going to be the best option, sometimes the advantage plans. It just depends on your situation and your money situation. If you're willing to pay a little bit more for it and have that peace of mind, I'd recommend looking at the supplement plans. If you're really wanting to not go to the doctor as often and save as much money as you can, I'd recommend the advantage plans. So it's kind of situation based, but some individuals, if you're coming onto Medicare and you're very healthy and you just never want to see a bill, if that's the case, then supplements are going to be the option. But those do go up yearly and are based off of age. So that's just something to watch out for. So the older you get, the higher those premiums are going to be. But the advantage plans, a lot of those are going to be $0 a month. So it's more of a pay as you go. You're only going to utilize those services if you use them, which 3% of people are ever going to meet that max out of pocket. But you could spend $100 on your health care, or worst case scenario is you pay that max out of pocket on your health plan. So it really just depends situation by situation.
All right, great. I appreciate you. Thank you again, Bryce and Tamara, today for coming in and helping to provide these resources for our communities. Again, we want to thank you. This is Bryce Graham and Tamara Kaufman today. If you have any questions at all, please reach out to him. If you can't find his information or not sure, by all means, contact Agent Advantage and we'll put you in contact with Bryce or Tamara, either one of them. But again, we want to thank you guys for your time and hopefully this was some great information. I'm sure it was because it was. I know a lot of people can benefit from it, but
Mhm.
we thank you so much for your time and attention today. And we will see you again next time on another ARPA Talk. Have a good
Thank
day.
you.
Thanks,
Thanks for
guys.
having me. I
Bye bye.
appreciate it, guys. Take
Thank
care.
you. Bye-bye.